Hi everyone, my name is Chisa Huffman, and my DNP project addresses the effects of workplace incivility on the nursing workforce and patient outcomes, with a primary focus on the most vulnerable population at risk, the graduate nurse with less than 1 year experience. This slide has been added solely to assist the viewer with structured guidance. Many of you have probably heard the term workplace incivility, but what is it really? Well, also known as horizontal or lateral violence, bullying, or harassment, the terms are interchangeable. DeMarco, DeFazio, and Vesey define workplace incivility as repeated offensive, abusive, intimidating, or insulting behavior, abuse of power, or unfair sanctions that make recipients upset and feel humiliated, vulnerable, or threatened while creating stress and undermining their self-confidence. So what makes this so different than the term bullying? Workplace incivility has no known reason for the behavior. It progresses to bullying when a reason or motive is attached or identified to the behaviors. It also does not include illegal harassment and/or discrimination. And there's more of a covert aspect related to workplace incivility. So why should we care about incivility in the workplace? Well, just to note a few reasons. In 2010, over 400,000 nurses left the workforce. 400,000. And in 2020, this number is expected to more than double. This is related strictly to workplace incivility. The literature has revealed the first problem identified, and this is a direct result of workplace incivility, is a breakdown in the communication. So why is this important? Well, in 2015, the Joint Commission conducted a survey regarding adverse events and found that out of 2,348 events that were reportable, 1,553 were preventable, and they were directly related to a failure in communication, a failure or breakdown in communication. So not only are we hurting nurses and the profession of nursing, but we're hurting our patients, the ones we took an oath to care for and protect from harm. Some additional significance, some financial information and some financial implications for workplace incivility is that it can cost up to an average of about $88,000 just to replace one nurse. The Workplace Bullying Institute estimates that 65.6 million U.S. workers are directly impacted by or have witnessed bullying. It's actually more common than sexual harassment. There was one U.S. hospital that employed 5,000 nurses, and they estimated the cost of workplace violent treatment at $94,000 a year. And this is in addition to having to pay, on an average, $88,000 to replace a nurse. Workplace incivility or bullying nurses, it leads to the erosion of professional competence, as well as increased sickness, abuse, absence, and employee attrition. The victims may suffer health-related problems such as nausea, headache, insomnia, anxiety, depression, weight changes, and it can even lead to the abuse of drugs and/or alcohol. Even witnessing just a single unpleasant interaction, it leads customers or patients to generalize about other employees as well as the organization as a whole. So let us recall what workplace incivility is while reviewing my PICOT question. While we're doing that, let us also remember and recall the most vulnerable population to experience workplace incivility, and that's our new graduate nurses with less than 1 year experience. Amongst acute care nurses in the hospital setting with less than 1 year experience, does providing conflict management and resiliency training during a nurse residency program versus no formal training affect turnover and/or improve job satisfaction over 3 months? Now, we're going to examine the literature. As you will see, we have here the ANA Code of Ethics. Taking action is a moral stance, and it's consistent with the ANA Code of Ethics. The entire nursing profession must actively drive a cultural change to end incivility, bullying, and violence in the workforce. ANA's Code of Ethics for Nurses with Interpretive Statement states that nurses are required to create an ethical environment and culture of civility and kindness by treating others, colleagues, coworkers, employees, students, and everyone with dignity and respect. A direct review of the literature. A total of 636 articles appeared within my initial search. After eligibility parameters were added, 216 were found. And of those 216, 13 articles were selected for data abstraction. Here are a few points or themes that arose that are key to workplace incivility. Within the 11 nursing studies that were reviewed, each one of those studies utilized a different approach to combating workplace incivility, but there was nothing consistent. This was evidenced by the author's inability to formulate and use a single designated approach towards defining what workplace incivility is. With the other two non-nursing studies, both studies engaged human resources. So for their first layer and way to prevent workplace incivility, nursing used a different approach, and the other two non-nursing studies both engaged human resources. All 13 studies were unable to come to the understanding and have one agreed upon definition of workplace incivility. However, they all 13 consistently identified the negative impacts of workplace incivility, and they are in no specific order. Increased adverse patient outcomes, increased turnover, decreased morale, increased intent to leave, increased levels of stress and depression, increased errors, increased financial burden, decreased productivity, and increased levels of burnout. The second key in the review of the literature is that the nursing studies preferred frontline leaders to address workplace incivility. However, the non-nursing studies, they preferred a legislature and top-down leadership style to address workplace incivility. Lastly, the nursing studies focused primarily on academia, creation of workplace zero-tolerance policies, and professional development for frontline staff as another intervention to combat workplace incivility. However, the non-nursing studies focused on an educational component for all employees during new hire orientation. And lastly, there was only one study that addressed the magnet component, and it's vital because it provided detailed information as to the implementation of utilizing certain theory, certain tools, and certain methods that could assist with combating workplace incivility. The limitations and gaps in the literature. There were few limitations, but the limitations that were noted were quite substantial. In all 13 articles, there was limited or small sample size, and that is evidenced by 20 and under participants within the largest sample size. There was only one single setting that was focused on, and it was on acute care med-surg floor. None of the results were generalizable, so they were not readily available to be able to be reflective in all areas of the hospital or all areas of nursing, including academia. And there was limited diversity. There was 98% of the participants were white, Caucasian, Anglo-Americans, leaving only 2% to be diverse. In addition, there was an inability for scholars to agree upon one single identifiable definition of workplace incivility, and that provided some room for ambiguity. And it also impeded the study because it detracts from people being able to research and understand and identify the similarities between the studies. Another gap in the literature. There was no cross-cultural considerations, and this would take into account the different ways that people interpret different types of verbal and nonverbal communication. And lastly, there were absolutely no studies that were found, even with the initial 600 studies, that provided any best practice standards or implication for technology integration. A mini review of my project. I will be utilizing 10 plus sites located throughout multiple states. This should take care of the sample size problem faced in the other articles reviewed. There will be multiple settings and not just an acute care med-surg setting. And the increased sample size will include a larger population of more diverse participants. We will have a pre, intra, and post data collection during the intervention period, which will consist of, but it's not limited to, the utilization of validated tools, patient satisfaction scores, employee satisfaction scores, patient outcomes, and other sources of rich data. We'll also be doing interviews and focus groups. The long-term goal of my project is to hopefully combat and decrease RN turnover and adverse patient outcomes that are directly related to workplace incivility. I would like to assist organizations towards creating a healthy workplace culture through education and awareness. The overall goal would be to generate research generalizable to most occupations through creation of a workplace incivility toolkit that's readily accessible to all. It should include all the components required to download and fully implement a course of action toward and assist other facilities and or educational academic environments towards combating workplace incivility. Thank you so much. Awareness is key towards combating workplace incivility.